Hi, I'm Dr. Kang, endocrinologist and also clinical assistant professor in University Tunku Rahman. I'm here today to answer a few questions from the internet. This is diabetes support. We will start with the first question by Laila K16, and she asked, why does type 2 diabetes mellitus impair weight reduction in patients with obesity? Actually, type 2 diabetes does not really affect your weight. Okay, it is actually the weight that causes type 2 diabetes. So in patients who are overweight and obese, they tend to be more prone to develop type 2 diabetes. And the next question by Marcy King. Why does everyone say being thirsty a lot is diabetes? I'm thirsty all the time and my numbers come back perfect. So thirst is actually your body's mechanism whenever you lose body fluids. So there are various reasons why someone can be thirsty. It can be because the weather is hot, you sweat a lot, or you've been drinking a lot of water and you want to pee. So when you pee a lot, you feel thirsty, so it can be because of that. If you are diabetic, your sugar is very high, and the excess sugar will be excreted into your urine, and with that your urine becomes very concentrated, and that in turn you drag all the water from your blood into the urine. So that's why diabetic patients who have high sugar levels, they have a lot of urine. So when all of the water in your blood goes into the urine, your blood concentration becomes thicker and you will feel thirsty. So it's your body's mechanism to replace, to dilute back your blood to its normal state. So that's why if you are diabetic and your sugar is very high, you can be thirsty. But those who are normal, they can be thirsty due to hot weather, or when you are playing sports, you lose a lot of water from exercise, etc. The next question by Denker22. What changed? Why are so many people obese? Why does bread, a staple of mankind for centuries, now lead to diabetes and weight gain? I don't know, but I stopped eating bread and processed sugar and I lost the extra fat around my belly and my irritable bowel syndrome disappeared overnight. What has changed? So your lifestyle has changed, the food that you take has changed. So why are so many people obese? Back then, most of the occupation are manual labor, so they use a lot of energy. So the food that they take is just to replace whatever calories they have used in work. As technology advances, we do not use that much energy at work. Okay, we tend to use brain more than brawn nowadays. So you do not use that much calories and you still eat the same. Okay, so you have excessive calories, which in turn will convert into fat and make you fat. Okay, also your food options have changed. Back then, we tend to take unprocessed food. Okay, your sugar is unrefined, your carbs are unrefined. Instead of taking white rice, you have brown rice, and etc. So now you are taking refined food, which is absorbed rapidly and converted into fat faster than unprocessed food. So that is why if you stop eating too much bread or other carbohydrates, especially processed sugar, okay, you lose all the extra fat around your belly. Okay, and all this processed food, refined sugar, has been associated with irritable bowel syndrome and other disease in the gut. So if you control your carbohydrate intake, take less refined carbs and sugar, you'll feel much better. Okay, our next question is by Tyrick Savon. Why the F does diabetes have to affect literally everything? So diabetes, it affects the cells in your whole body. So that's why it affects everything. Okay, it affects your blood vessels. So your limbs, okay, the blood vessels that supply your brain, your kidney, your heart, everywhere is affected. So that's why if you have diabetes, basically your whole body, okay, it gets damaged from diabetes. The next question by Smita Rao 18. Does excessive pain in ankle and sole of feet indicate diabetes? How to check the diabetes authentically when doctors are there to scare us? It depends what kind of pain you have. The typical pain in the foot due to diabetes is because of nerve injury. Okay, your sugar is too high, it damages the nerves. So the typical neurological pain in diabetic foot are tingling sensation, pins and needles, or electric light shock. Okay, usually those are the classical pain due to nerve injuries. If your pain is dull or chronic or is due to sports injury or you hit something, then the pain will feel totally different. Also, the treatment for diabetic nerve pain is so much different from the pain that you're taking when you have a sports injury. Our next question is by Kolmi Kokowan, whom asks, how does the insulin pump work? Okay, I tried googling it and it didn't make sense to me. Is it similar to a sensor? So the insulin pump is just a device that continuously pumps the insulin into your body at a dose that you have fixed. Okay, so the amount of insulin you need depends on various reasons. Your body weight as well as how sensitive your body is to insulin. So it only pumps insulin and you have to manually control the rate. So when you eat, you might want to increase, but when you're not eating, you're sleeping, you might want to cut down the rate. So nowadays you have a continuous blood glucose sensor which is connected to your insulin pump. So the sensor will detect your sugar readings and send a message to your pump, so your pump can automatically adjust the insulin rate according to the sensor. Okay, so it's like a feedback loop. Okay, so this device, it has two components, the pump and the sensor. So sometimes you may need two devices separate, but nowadays with more and more modern technology, there are companies which have developed a single device where there's both a pump and a sensor. Okay. How does diabetic affect the eye? So when your sugar is high, it will affect all the blood vessels in the body. So the high sugar can cause inflammation in the blood vessels. So in your eye, there are blood vessels that supplies blood, oxygen and nutrients to your cells in your eyes. So if you have diabetes, okay, all these vessels can be affected, and as a result, it can affect your eye. You can be blind. Okay. Also, the high blood sugar can affect the consistency of your lens. You may develop cataract easier. Okay, and also can affect the blood supply and secretion of fluid in your eyes can cause glaucoma as well. Here, Tiknok, who asks, today I found out diabetes can cause erectile dysfunction. What? Okay, so diabetes affects all your blood vessels. So if it affects the blood vessels, okay, and the nerves that controls the muscles of your genital, okay, so you may have difficulty in getting an erection or sustaining an erection. So it is a known cause that diabetes can cause erectile dysfunction. Another question by Ronan Laura 62. I heard insulin is all over the place. Is insulin the only solution if I get diabetes? It is so expensive in the long run. Okay, so number one, it depends what type of diabetes you have. If you have type 1 diabetes, which is due to the destruction of your pancreas, in other words, your pancreas is gone, you have no insulin at all, hence you need insulin replacement. But if you have diabetes, which is type 2, which is a condition due to insulin resistance, it can be treated with oral medications. However, if your diabetes is very chronic, it's been there for many years, or your diabetes is poorly controlled, you may need insulin for treatment of type 2 diabetes. So it depends on what condition you have, type 1 or type 2, and how bad is your diabetes. Okay, and in Malaysia, although insulin is a bit costly, but it is heavily subsidized by the government. So in Malaysia, insulin therapy is all the time quite affordable. Okay, JPJR912 asks, what's so scary about diabetes? Is it life-threatening? It is so common in my neighborhood and none of my neighbors seem to worry about it. The thing about diabetes is it affects everything, okay, and it results in all sorts of complications to the brain, to the eye, to the heart, the kidneys, etc. So it is scary in the sense that in the long run, it causes a lot of problems, okay, but you do not die instantly, okay, from diabetes. Usually it takes a long time for all this to happen. Because of that, okay, when you have diabetes, you do not have any acute symptoms, you don't really feel anything. Okay, so that's why people do not worry about it until they have developed severe complications of it, especially a heart attack or a stroke. I've seen the night asked, I had diabetes and none of my family members have it. Why is it happening? Is it dangerous? So diabetes, it has a strong genetic predisposition, but it may be because you do not have the gene, that's why your risk is lower, or your lifestyle is different from family members. Okay, your family may be active and they are taking care of the diet properly, and you may not be doing that well. So there's actually various reasons for that. So the best is for you to see a doctor and let him find out why you have diabetes. It could be type 1 or type 2 or others. Okay, is it dangerous? Well, if your diabetes is not controlled over the long run, it could be dangerous. Robot Life asks, what kind of diet should I follow if I have diabetes? Intermittent fasting, ketone diet, or what? I have no idea which one fits me the most. Of course, the best person is to see a doctor or your dietitian to ask in detail. But generally, if you have diabetes, you are supposed to cut down on your carbohydrates intake. You should only take what is required. So depending on your daily activities, how much do you do? Okay, and then you should take the proper amount of carbohydrates to replace your daily needs. And of course, you need to maintain enough protein and healthy fats intake, as well as fibers and other vitamins. So you need to have a proper healthy diet. Intermittent fasting may work unless your sugar is very, very bad. Okay, so if your sugar is not too bad, you can do intermittent fasting, okay, and that will help with your sugar control and your weight loss. Ketone diet is really not advisable because when you starve yourself, your body produces a lot of ketones. And these ketones itself can overload in your body and results in other complications. Okay? So the best way is to consult your dietitian or your doctor. Those are all the questions we have today. Hopefully you have learned something today. So see you next time. A special thanks to the Malaysia Endocrine and Metabolic Society MEMS for being our sponsor. So this has been Diabetes Support.